My name again is Kim Cauley Eckel. I'm the founder and CEO of Footbridge, and again, very excited to be here. So, Footbridge is a 501(c)(3) that I founded in 2020 while working as a child welfare administrator. We began our work in the Pittsburgh area and are expanding our work into new states. Footbridge provides rapid, gap-filling support to prevent basic needs emergencies from escalating into situations that require disruptive and expensive health or human service interventions. Evaluation findings using administrative data from both human service systems and health insurance claims indicate that 6 months post-intervention, nearly all of the families that Footbridge has helped have not required homeless shelters, mental health hospitalizations, or child welfare intervention. And many have begun successfully adhering to healthcare regimens. And I'm going to say a lot more about this later on. Our organization was asked to present our outcomes to both the staff of the Senate Finance Committee and at the White House this past summer. And let's see if I can advance the slide. So I founded Footbridge in 2020 because of an issue that I saw seeing in our child welfare system here in the Pittsburgh area. Namely that when a financial crisis for a family is unable to be resolved, child welfare can often be pulled in. To illustrate this, I'd like to just provide a story about a woman I will call Sarah. So Sarah had a job, but no housing. She had found an apartment where she could afford monthly rent, but she had no way to come up with the additional $700 she would need as a first month's deposit. So because she was technically homeless, because she couldn't come up with $700, about the cost of a mattress, and had nowhere else to turn, child welfare was forced to remove her children and place them with a foster family at what will amount to $56,000 for 6 months. So $56,000. There are over 200 homes currently listed in the Pittsburgh area for less than that. Footbridge provides the opportunity for a much more efficient solution. Footbridge works on the basis of partnering with frontline professionals who can help validate the need that a family has, ensuring that all other resources have first been exhausted. Footbridge staff can then pay third-party vendors, such as landlords, utility companies, or car mechanics, as rapidly as necessary to mitigate the crisis. The healthcare sector is an incredibly important part of our society, and it is often pediatricians who have the most interaction with families with young children before they start school. From a human service perspective, this is an incredible opportunity to engage families via partnerships because this is where families' relationships exist. Thankfully, the health sector seems to value partnership as well, recognizing the impact that social determinants of health have on physical health. So social determinants of health, if you're here, you probably know what they are, but they're the conditions in which people are born, grow, live, work, age. They significantly influence health outcomes, functioning, and quality of life, and they include socioeconomic status, education, neighborhood, physical environment, employment, social support networks, and access to healthcare. Some studies suggest that social determinants of health account for 80% of health outcomes. Recognizing the significance of these factors, there has been efforts to try and address families' socioeconomic needs. The Camden Coalition, a model built in New Jersey, gained national attention as a model for family engagement and bridging healthcare and social services via intensive service coordination. In 2014, an MIT economist began a randomized controlled trial with 800 patients over 4 years. Half of them received intensive case management, the others did not. And the result, however, was not what the public had hoped for. The 400 patients who received the intensive help were just as likely to return to the hospital as the patients who didn't. In both groups, nearly 2/3 of people were readmitted within 180 days. The research for this study is published in the New England Journal of Medicine. NPR and Kaiser Health News responded to these results by digging deeper through qualitative research. And what they found is that it is actually gaps in our safety net that led to these disappointing outcomes. I have a little screenshot of one of the articles and just will highlight. The coalition has learned that for people living in poverty with poor health, a small hiccup, in Moore's case, a missed rent payment, can spiral into a major setback. Time-sensitive financial emergencies arise in part because of gaps in support in our social services system. These gaps result from income eligibility caps on available support, when families do not know about or apply incorrectly to existing programs, when the inflexibility of existing programs is unable to accommodate time-sensitive needs, or when there simply isn't a program to meet the crisis presented, such as a family's need for a car repair or support for medical copays. The social cost of these gaps in support, often modest in absolute dollar terms, is often tens of thousands of dollars once a crisis has worsened to a point where health or human service interventions are required. Footbridge was founded to get around the red tape that big bureaucracies and systems face. Our approach is not a one-size-fits-all, but rather is responsive to each family's unique situation. Footbridge works with every kind of professional who may engage with a family, from school counselors to pediatricians, who can help us identify those families who might otherwise fall through the cracks. Our onboarding process ensures that they help us find those instances when an urgent need can't otherwise be resolved, but if addressed, will lead to stability. Families only need a phone to receive our call and work with us, and we can follow up on referrals as expeditiously as needed. The fastest we did was 3 hours from receipt to paying the bills. During our call with families, we ensure that Footbridge support is appropriate for their situation and screen for additional needs. Footbridge closes the loop with referring physicians and social workers and shares the outcome letters that we create for families with those who made the referral so that our recommendations for other supports are known to all. Some healthcare providers upload our letters to patients' electronic health records. And we can encourage messaging deemed important by the practices we work with, such as encouraging families to remember and attend their well-child visits. So now on to the exciting part. Our approach is commonsensical, but what are the outcomes? Footbridge has worked with nearly 2,000 families since our inception, and 96% of those surveyed 1 month following our aid state that Footbridge's intervention prevented their crisis from escalating, with 80% finding the aid is still making a difference for their family's situation 6 months later. What does this mean for families? So I've shared some of the quotes that families have provided to us when we've asked them. I'll read them. When you're stressed and overwhelmed, we all want to act like we're perfect parents and we never, give our kids any of our energy, but that's a lie. When you're overwhelmed, those emotions show because you don't want to be bothered. You don't want to talk because you're trying to figure it all out. And this other one, which I'm having a difficult time seeing because of the little slide of all of us here, is from a parent after we helped them. The mom is basically saying, I wasn't able to play with my boys. I was always trying to connect the dots about the bills or freaking out. I wanted to engage with them, but I couldn't. And having this weight lifted off of me has been a great change. Footbridge has made data collection and evaluative partnerships a priority since we began our work, as I have sought sustainability for Footbridge's work as a poverty amelioration tactic by attempting to highlight the ways in which our model makes business sense. So for human service agencies, this means highlighting the way in which addressing a family's unique needs in the moment they need it can prevent more expensive system involvement. For health insurance plans, this has meant considering how our model impacts the job satisfaction of medical providers and how it influences patients' behavior with regard to their own healthcare regimens and attitudes towards their healthcare providers. Footbridge interviews and surveys those whom we help immediately following our assistance and at 1, 3, and 6 month intervals following our aid. We also have data collaborations with our key government and insurance company partners, allowing us to examine the longitudinal impacts of our work in relation to health and human service administrative data. Some of our evaluation results to date include 92% reporting being less stressed and 96% more hopeful. 80% report that receiving financial assistance from Footbridge has enabled them to be their best selves when parenting. And I think the quotes from earlier alluded to that parents themselves recognize that when they're under this weight, it's very difficult to be present and there for their kids. 1/3 of our clients state that we helped mitigate a mental health crisis, which I think is really something to be said there. This self-report data is substantiated by administrative data. In the 6 months following Footbridge's aid, only 0.04% of our clients had to use an emergency shelter, with none having to use a day shelter. Fewer than 1% had an inpatient hospitalization, and only 1.5% sought services for a mental health crisis. Again, 1/3 of our clients self-report that we helped mitigate a mental health crisis. Excluding families with child welfare involvement prior to our intervention, only 2% of our clients had to have a child welfare case opened in the 6 months following our aid, and 0.5%, that was the amount, had to have a placement. Footbridge has partnered with two major healthcare plans thus far, and what I'd like to conclude with is some of the findings from our health insurance partners. So our evaluation efforts in this space fall into four buckets. Provider sentiment about trying to address social determinants of health more generally, provider sentiment about having Footbridge as a tool, our clients' feelings about their trust in their medical provider and willingness to attend appointments, and finally, healthcare claims analyses. So in the interest of time, I'll share the high-level findings. In a pre-pilot analysis, one of our health insurance partners found that the top barriers to addressing patients' social determinants of health needs were lack of resources and time, with many indicating that these barriers negatively impact their job satisfaction and stress levels. Two quotes that I'll share. If there are needs that require immediate financial assistance, I do not have many reliable resources, and it makes the patient less hopeful than before the meeting. A different quote. If the necessary resources are unavailable to assist patients, then it seems I cannot do my job effectively. This breaks the trust, hopefulness, and relationships that I attempt to build with patients, which is sad and stressful. And finally, the quote on the screen. It is very stressful when a client has needs I can't meet. I feel that it damages our relationship and that if I can't offer a resource, they don't trust me to help with anything. In May 2023, one of our health insurance partners interviewed health plan staff and supervisors to gain perspective on the impact on providers of having access to a resource like Footbridge. Care managers and their supervisors were overwhelmingly positive about the impact of Footbridge as a resource. Some interview themes included how timely and responsive Footbridge was after submitting a referral. Staff also spoke about how helpful it was to have a resource with consistent funding, unlike a lot of other community resources who often were not accepting referrals due to a lack of funding. And access to a resource like Footbridge was noted to improve staff job satisfaction. Another care manager supervisor piggybacked off of this sentiment and spoke to the importance of financial resources like Footbridge to allow care managers to take a more global and holistic approach when approaching their members. The supervisor spoke about how when someone is facing homelessness or financial burdens, they cannot focus on their chronic health conditions because they are often dysregulated and focused on the immediate crisis. Having Footbridge addresses their immediate crisis allows the case managers to work with the member to get them back on track in managing their health conditions, and the care managers who referred to Footbridge often spoke of the direct impact on health benefits for the members who received financial assistance from Footbridge. And here's another quote. Having a resource such as Footbridge, I just can't describe it differently than life-changing, life-saving. The stress that a lot of these members face, having to choose, do I get groceries this month or do I pay my utility bill? Part of my quote's cut off. Sorry, guys, I'm ad-libbing here a little. To have the stress that puts on a person and how that impacts, let's see if I can move this. Yes, I can. Oh my goodness, I can. I'm so sorry. Let's see here. To have the stress that puts on a person and how that impacts their behavioral health or their physical health, conditions or both, it's a root cause of a lot of times what drives people to having unmanaged health issues. And to see if we can resolve these root issues, that they can then take that energy and time and focus on their wellness and their health. So looking at our survey data, we have found that 92% report feeling better supported by their referral partner, and 88% report that it would increase their likelihood to keep engaging with and attend appointments with the referring organization in the future. Given what we know about how to try and mitigate social determinant of health risks, this is pretty powerful. Finally, healthcare claims data suggests that addressing financial crises enables individuals to better manage their health conditions, with hospitalization and specialist costs decreasing and pharmacy costs increasing in the 6 months following Footbridge's aid. These findings are noteworthy as compared to the general Medicaid population. Um, it was discovered that Footbridge's applicants have a higher prevalence of chronic conditions. So, for example, 33.6% of health insurance members who received Footbridge aid had asthma relative to 10.9% of the general Medicaid population. For diabetes, 13% were those Footbridge clients relative to 5% of the general Medicaid population. 33.2% had hypertension relative to 10.6% of the general population, so etc. All in all, our evaluation findings suggest that preventing financial crises from escalating is not only good for families, but for society at large.